We begin Denver 7 News at 4 with breaking news. Tragedy in Texas. At least 15 people are dead, the majority of them children, after a mass shooting at an elementary school in Texas. Authorities say it happened earlier today in the city of Uvalde, which is about 90 miles west of San Antonio. Texas Governor Greg Abbott confirming that 14 of those deaths are children. The other one is a teacher. He also says law enforcement killed the shooter. Right now, let's get the absolute latest from ABC's Rena Roy.
Police say it appears the shooting began off school campus. Then the suspected 18-year-old shooter went inside Robb Elementary School after some kind of encounter with law enforcement. More than a dozen people rushed to area hospitals.
He shot and killed horrifically, incomprehensibly, 14 students. And killed a teacher.
Sources describing it as a gruesome scene. This is a small rural town of about 20,000 people, just about 60 miles from the Mexico border. It's predominantly Hispanic. Officials are now reaching out to parents as quickly as they can to alert them of this situation.
Just confused and worried. I'm trying to find out where my baby's at.
The ATF and FBI have all responded to the scene. Right now, all of these different agencies working to piece together what exactly happened here in the latest tragic mass shooting in America. Rena Roy, ABC News, New York.
And Governor Polis, who just finished visiting an elementary school today in southwest Colorado, said in a statement, Colorado's hearts are heavy for our friends in Texas. We've also learned that the president has been briefed about the situation in Texas. He is expected to speak at about 6:15 our time. We will bring that to you live as soon as President Biden steps to the podium. The president also recently visited Buffalo, New York in the aftermath of a mass shooting in a grocery store there. Now, of course, we will continue to follow all the latest developments out of Texas and do our best to honor and remember the victims there and the community now in mourning. We will bring you the latest as we learn it throughout the evening here on Denver 7 News and on thedenverchannel.com.
We're looking at what it'll take to address the spike in deaths from alcohol, drugs, and suicide we've seen during the pandemic.
We started this report about 5 years ago, and it was in recognition that there were these disturbing trends that were continuing to go in the wrong direction. Deaths to drug, alcohol, and suicide were spiraling out of control. And really looking back to beginning in 2008, the Great Recession is when we started to see a lot of these constellation of individuals that were dying.
The Pain in the Nation report, released today by Wellbeing Trust and Trust for America's Health, highlights the latest CDC data. It shows that we lost more than 186,000 Americans in 2020. There's a 30% increase in drug-related deaths from the year before and a 27% increase in alcohol-related deaths.
And while we did see a small reduction in suicide, about 3%, that was not uniform across the board. A very disturbing trend that I think we see in these data is that our youth, the young folks in our country, are dying by suicide at higher rates.
The report also lays out solutions like prioritizing prevention through public health investment, bringing care to people directly, like focusing on schools and modernizing mental health and addiction care.
It's opportunities to look at things like harm reduction. What are ways that we can provide safer ways for folks who are using drugs to stay alive? We make people work way too hard to get access to care. They got to jump through 16 different hoops before they can find the right provider that can help them. That needs to be changed.
He says the new 3-digit code of 988 that is launching for the National Suicide Prevention Lifeline this summer is an opportunity to reimagine crisis response. He mentioned community efforts already working, like the Confess Project.
This is a training that goes into barbershops and helps the barbers work with Black men on issues of mental health.
All right, some other news now. A Colorado woman will not have to pay hundreds of thousands of dollars in medical bills after the state Supreme Court ruled that she was not responsible for the charges. Lisa French went to St. Anthony's North Hospital in Westminster for back surgery in 2014. Initially, she was told she would only be responsible for covering $1,300 of that bill. After the surgery, the hospital told her it read her insurance wrong, and she was actually responsible for nearly $230,000 because she was an out-of-network patient.
I just think the hospitals should be there to help patients and help us understand what's going on and not keep things hidden and secretive and, made a mistake, but I got to pay for that mistake.
The Colorado Supreme Court ruled this month that the paperwork French signed was not clear enough about potential costs for its health system database. Centura Health did not respond to our requests for a comment.
The neurological symptoms of long COVID can go on for more than a year. That is what new data is showing from a study at Northwestern University. Researchers say
All right, well, we are going to head to break real quick, but coming up after that break, Colorado got some much needed moisture from this weekend's snowstorm, but up next, why that could actually be a bad thing when it comes to wildfires. Stay with us.